WJR.
I want you to think of a beautiful Saturday, fall, Michigan day in Ann Arbor. 100,000 people in the seats of the big house. That's how many people we lost to drug overdoses over a 12-month period ending last April. It is staggering when you consider how many personal tragedies that accounts for. Well, now, an interesting development, a controversial development. The Biden Justice Department is signaling that it may be open to allowing what are called safe injection sites. These would be safe havens for people to safely use heroin or other narcotics with protections against fatal overdoses. The Associated Press asked the Justice Department about it, and it did confirm. It is evaluating such facilities, but also talking to regulators about appropriate guardrails. So what would they look like? How effective are they? Are there unintended consequences? Are we acting as government-sponsored enablers here? But most importantly, are we to that point that we really need to change our strategy to protect lives, especially with the threat from fentanyl? Jaimie Clayton is the president and CEO of Oakland Family Services. I have known Jaimie for over 20 years. She has been on the front lines helping families battling addictions for that long and maybe even a little longer, and we welcome her to the Guy Gordon Show. In full disclosure, I serve on Jaimie's board. Good afternoon, Jaimie.
Hi, Guy. Thanks for having me.
So these safe injection sites, we know they're common in other countries, and they're also in some locales. Some cities have put these together. Do we know, do users really avail themselves of them, and just how effective are they at reducing death?
Yeah, so I'm glad you clarified that, Guy, because what the DOJ is talking about is getting involved to regulate them. That does not mean they do not already exist. They do. Several are grassroots startups. You will often find them at concert venues and especially the big traveling shows. And then there are grants from various entities that also fund these. So the DOJ's involvement is a next level involvement. And for those who are really concerned, it should offer some consolation because they're looking to regulate these differently. Those of us in the treatment world really see this as just one potential aspect of a full continuum of treatment. But they're really about harm reduction. It is completely false to say that more people are going to shoot heroin or do drugs or fentanyl because these sites exist. That's not true. What we're doing is bringing people out of the shadows and saying, instead of shooting up someplace that's not safe, that's not controlled, this is a more controlled environment. It's also a public health measure because there's a needle exchange that allows people to have clean needles and a controlled supply instead of an endless supply and not use the same needles over and over, which often causes hepatitis and HIV and other kinds of chronic diseases. So for us who believe that there is no bad way to look at treatment and anything that opens the door to allowing us to have more access to people to talk about treatment, think that this is a good thing because most of these safe sites do allow and encourage and provide some form of access and entree to treatment, not just like, hey, come in and shoot your drugs.
Exactly. I mean, it's face-to-face and an opportunity for intervention.
Correct.
But I also know that, I mean, obviously fear of overdoses is maybe one of the reasons why people seek rehab.
Correct. Yep.
If you put them to a safe environment, are we inadvertently removing what could be a motivator?
No, because that's kind of, fear of overdose. Most people overdose several times before they're afraid enough of overdose to get treatment. That's not necessarily the case. Yeah, I mean, most people have several overdoses by the time they're using. And, the same fears came up about Narcan, Guy. Oh, let's not use Narcan, which, as you know, is an injectable that brings people back from overdose. It counteracts opioids. And there was that's a step of harm reduction. And there was a big push of we shouldn't train people, we shouldn't train cops. Cops didn't want to be trained at first because, if we can just bring people back from overdose, they will not, they'll just walk away and not get treatment. Well, there's a percentage that's true, and then there's a percentage that it's not. The approach of, let's let people get sick in withdrawals that is not the approach that works, that we know works anymore. Addiction is a brain disease, and it is a physical disease that people need help controlling. A safe site with safe injection is one aspect of that. And so if it's if we can keep people alive and safe and healthy, we're more likely to get them in treatment than if they die or if they're out in the shadows using at home or using with their friends. You know, the pandemic, we've seen overdoses absolutely explode because people are using in isolation. They're not out with people or other friends where there may be some control or some measure of how much they're using or access to Narcan or a safe site and a clean needle. I know it feels contradictory, but it's not.
Yeah. Okay.
I know it sounds odd.
We should point out here.
Weird.
Right. So we should point out here, they're not providing them with drugs as they do in Europe.
Correct.
This is a public health kind of strategy. I do worry that it might appear to some, that by the Justice Department giving their seal of approval on this and regulating it, that the unintended message is that we condone it, that we're normalizing it, and that in some ways we've got government being an enabler.
Yeah, I mean, I think there's going to be a risk of that, Guy, but I actually think that the people who are using don't care and don't listen to any of that. If you're a heroin addict, you don't really care what the DOJ is doing. I mean, straight up. That's not something that you're interested in. It's not going to endorse your use.
No, I'm talking about those that aren't users yet. That there is, to some degree, that you're condoning it, you're destigmatizing it to a certain degree, and that may lead to more abusers.
So we don't really see that. By the time you're so deep into your use, if you're using and shooting drugs, there's so many steps along the way of your addiction that you're getting there. This is not the thing that will desensitize you. The data just doesn't back that up in the same way. Just like, you can battle about the legalization of marijuana and it being a gateway drug. There's truth in all of this. So sure, there might be a small percentage of people that applies to, but really what it's destigmatizing is the opposite. It destigmatizes treatment and it destigmatizes that public health, and it destigmatizes addiction because it opens the door to people being willing to see it as a health problem, a public health malady, and allows treatment providers like us to have access to people we wouldn't to talk about how to access treatment. You know, by the time you're shooting heroin, you don't want to be. It's a miserable experience. And so you're physically addicted. You usually have lost the supports in your life. And you have a major health crisis going on. And so if you can get someplace to shoot and be safe and get some safe needles, and we can get in your ear and start destigmatizing treatment and what that looks like, that is going to be far more powerful in terms of what we can do for the overdose dilemma that we have and the drug use and substance addiction dilemma that we have than what the DOJ will do in terms of stigma.
Okay, and when the DOJ is talking about appropriate guardrails, and you mentioned this is just one strategy, very quickly, because I've run out of time, what else do we need to be doing to make sure this doesn't make the problem larger, that it does shrink the problem?
I think that we have to be sure that safe sites are run by reputable organizations, that they are monitored, that they are licensed, and that the things that we know work and what the evidence and research says is what's really happening. And so I do think that's where I do think the federal government can help so that we can have these things run like facilities that we have oversight on.
And that there be a perpetual attempt at intervention?
Yep, absolutely. Treatment, a safe site cannot stand on its own. It must be part of a continuum of offerings for treatment and intervention.
That's a great place to wrap it up. Jaimie Clayton, thank you so much.
Thank you for having me, guys.